Hello, my name is Christina Wynn, and I am the Director of the Federal Emergency Management Agency, commonly known as FEMA. This is a public service announcement. Today, December the 15th, we have just received reports from one of the nation's largest research facilities that thousands of reports made to the CDC of a mystery disease was found that an influenza vaccine released in September has mutated, causing paralysis and or death. This vaccine was not available to the public until October. It was used during the time frame of October the 1st through December the 15th, before the contamination was found. Half of the dosage of the synthetic vaccine has been found to mutate within 30 days of the injection period, causing severe acute issues that start off with vomiting, diarrhea, high fever, and headache. This potentially deadly vaccine was distributed in 21 states within the Northeast and the Midwest region. For a complete list of these states, please visit the Center for Disease Control on their website at www.cdc.gov. 75% of the vaccine that was available has been issued. At this point, the other 25% is being collected and analyzed by the CDC. After all the testing have been completed, the remaining doses will be destroyed. At this time, we do not have any counteractive drug available. The National Incident Management Team, members of the CDC, along with emergency medical teams, are working around the clock to find a means to combat this outbreak. Anyone who may be experiencing any vomiting, diarrhea, high fever, and or headache after receiving the flu shot within the period of October the 1st to December the 15th should immediately seek medical care. We're asking the parents and the caregivers of the elderly and disabled who may have received a vaccination within this period, please pay close attention to any symptoms that your child or your loved one may encounter and seek immediate medical care when needed. Please inform the medical facility of the day and the location you received your vaccination. The vaccine was initially distributed within 21 states. Only the second half of the batch of the vaccine was contaminated. Due to the packaging process, however, the vials were mixed up and are now impossible to identify the infected vaccine. Initial illnesses were discovered in 9 states, those states being Maine, New Hampshire, Ohio, Kansas, Minnesota, North Dakota, South Dakota, Indiana, and Iowa. As of today, those that have been sickened is reported to total around 25 million people across 5 states. Those that have been paralyzed have been reported to be over 256,000 patients, with approximately 55,000 of those resulting in death. Although we have not received reports of we have not received any reports of this being a bioterrorist threat, it has not been ruled out. For a complete listing of the cities affected, resources, and other information, please contact the Centers for Disease Control at 555-123-5555 or log on to the CDC's website at www.cdc.gov. Your local health department will have information as well. FEMA, the CDC, The National Incident Management System, known as NIMS, and many local agencies are working diligently around the clock to monitor, investigate, and solve these issues. More information will be available after the remaining vaccine has been collected and analyzed by the CDC on December the 16th. We will update you on all details as they are confirmed. Please remember to remain calm as possible if you, a family member, or someone around you becomes ill from this vaccine and get medical help as quickly as possible. Thank you and good night.